Welcome everyone. So we start now with the Geriatric Interprofessional Education module, and I will be covering the module of Ophthalmology. I am Dr.Rashmi Jain and I will be taking you through what you need to know to understand cataract. When we are talking about this condition, what is the aim of my particular module today? It is to equip all the students with the knowledge to identify signs and symptoms of cataract in elderly patient, and also to understand the importance of timely referral to an ophthalmologist for further confirmation and diagnosis. What are the objectives? The objectives are basically of three types. That's understand what is cataract, recognize signs and symptoms, and the referral process involved in that. So I'll be taking you through each of these objectives over the period of next few minutes. In this particular module, the structure which we are following is, we'll be talking about what is cataract, we'll be talking about signs and symptoms of cataract, that is how you can recognize cataract, differential diagnosis, what are the things it can be if it is not cataract, how do you refer a case, and how do we communicate with the patient. So let's start off with what is cataract. If I define cataract, it is the clouding of natural lens of the eye. The lens lies behind the iris and the pupil. Pathophysiology of cataract is multifactorial, but it involves the clumping of protein in the lens, which leads to lens opacity. Normally, these proteins are clear. When they get clumped, they lead to blockage of the light, and hence it is called as lens opacity or cataract. Cataract is one of the leading causes of blindness globally. Prevalence increases with age. By the age of 80, more than half of the Americans and Indians either have cataract or have had cataract surgery. What are the risk factors for cataract? The most important is age. Second is diabetes, where as a person who is diabetic is at an increased risk of developing cataract. Smoking is also associated with increased cataract formation. Prolonged exposure to sunlight, UV light exposure can also be one of the contributing factors. Other factors such as a family history, conditions like hypertension, obesity, previous eye injury or inflammation, prolonged usage of corticosteroids, excessive alcohol all contribute to development of cataract. How do we identify cataract? The most important and common symptom of cataract is visual symptoms. That means blurred vision or inability to see clearly what you were seeing clearly earlier. Patients will also have difficulty with night vision. There may be glare, halos around the light. Often patient perceives the colors as faded. That means there is a change in perception of colors. If a person is using glasses, he might notice that he requires frequent changes in these glasses. He may also complain of double vision or seeing two images in one eye. There can be some case scenarios which I'll take you through. For example, a case where an elderly patient with progressive blurring of vision and difficulty driving at night comes to you. Another case where a patient experiencing frequent change of eyeglass prescription and he also sees halos around the light. Another case, a patient notices, I am seeing less and at the same time the colors are dulled and yellowed. So these are some of the ways an elderly patient may present to us. What are the differentiating conditions? The differentiating condition, one of the commonest one can be glaucoma. This is characterized by optic nerve damage and may be associated with increased intraocular pressure. They can have symptoms of loss of peripheral vision, also called as tunnel vision, pain in the eye, halos around the eye, and redness in the eye. Second condition is another condition which is age-related. It is called as age-related macular degeneration. It affects macula. This is the part of the eye which is responsible for the central vision. The symptoms here may be blurred or distorted central vision. A patient may complain of difficulty in reading or recognizing faces. They may also complain of empty or dark areas in center of their visual field, that is known as scotomas. Diabetic retinopathy is another differential diagnosis. In this, a diabetic patient may have damage to the blood vessels present in the retina because of the high sugar levels. The symptoms can be floaters or seeing black spots in the eye. There can be blurred vision. There may be darker areas of vision or scotomas. There may also be a difficulty in perceiving colors. what do we do? Now, if I just discuss with you, and what we would like to discuss is how do these symptoms overlap and what's the differential diagnosis. Similarity, almost all of these conditions present with blurred vision. Second similarity, halos around the light may be present in cataract and glaucoma. What is different? Cataract is typically a progressive blurring and clouding of vision. It is not a sudden visual loss. Age-related macular degeneration mainly affects central vision. Cataract affects overall clarity of the vision. Glaucoma is another condition which affects peripheral vision. It may be associated with eye pain and other symptoms also like halos, not just loss of vision. Now, once we know that we have diagnosed a patient to have cataract or any of these conditions, it is important for us to refer the cases. How do we refer? First, diagnose early. Any patient complaining, presenting with these symptoms, and on examination when you find such things, then do refer. What are the steps for making a refer? Document it. Make a note of the symptoms, document and then communicate with the ophthalmologist. Inform them that we are sending a case which looks like having cataract. And of course, never forget to follow up a case because these are the patient you might be seeing again. So make sure you follow up the case if the patient has actually visited the ophthalmologist. It's very important the role of primary care providers in this referral process. Now, the most important part when we make a diagnosis or a differential diagnosis and we refer is your communication. If you are not able to communicate effectively, the patient may not be convinced of the need to visit an ophthalmologist. So, how do we communicate? Minimize background noise. Do this communication in a place which is good, comfortable for the patient as well as for you. Use clear, simple language which is understandable to the patient and patient relatives. Allow a little extra time for discussions and questions. Don't just speak. Ask them to clarify any doubts they have. It's a very good idea to use visual aids, written material, diagrams to reinforce what you are trying to tell them. Remember, in this communication, it is important to educate the patient about cataract, to tell the patient what can be the complications if he does not visit a specialist, because cataract is a condition which requires surgical management. If I conclude, to summarize, I would like to say that this particular module, over last few minutes, we have just tried to give you a comprehensive understanding of cataract. We focused on signs and symptoms in elderly patient, the importance of timely referral and communication when we are referring a case or diagnosing a case having cataract or diminution of vision. And what I would encourage you to do now is, you're aware how to diagnose cataract. I would be happy if you apply your knowledge in a clinical setting and continue this learning in geriatric ophthalmology through further modules which we will be putting up. So thank you.